I'm now joined by Dr. Victoria Rose here in our London studio. She's a British consultant plastic surgeon and has been to Gaza several times since Israel's war started. And she's volunteered at Gaza hospitals, helping many Palestinians, many of them children. Doctor, welcome here to our studio. We just heard that there's been a forced displacement order by the Israeli army to civilians, but also to medics. What does that mean, and what's your reaction to this? And I'm sure you have many colleagues there as well. What are they saying?
Well, we're quite shocked by that order for medical officials and all of the NGOs to move their teams and their patients out of North Gaza. I mean, there's two main centres that are still operating, Al-Quds Hospital, and there's part of Shifa that's still operating, so patients still at both those major sites. The issue is going to be where they can go, because obviously we know that the Saladin Road is mainly in the active fighting zone, so there is no good route now down to the south in Gaza. And even if you could get down there, the issue remains that the only hospital standing is Nasser, and Nasser is in an active fighting zone. So getting in and out of that hospital means that you are taking a huge risk to your life.
It's incredible, because also our colleague earlier, who's in Gaza City, he just said, how are we going to walk 40 kilometres and have a map of Gaza here? And we also heard Philip Lazzarini saying people are exhausted and that they need assistance. I mean, is this even logistically possible, feasible at all?
Well, I think the thing that we're mainly worried about is the state of the population at the moment. We know that they're all severely malnourished, but we've been hearing from our colleagues at NASA that there's been a real high rise in enterovirus, which is oral fecal spread. And obviously, you know that most of the population are living in tents. There's virtually no clean water and no sanitation. So the spread of this virus is rife, and it's actually now triggering an autoimmune response. And the NASA complex have seen 100 patients in the last month present with flaccid paralysis. We do see this in the UK and America. It's known as Guillain-Barré disease. It's something that occurs very rarely, and even in Gaza, they would say that they probably only see 1 or 2 cases a year. But the WHO today said that since the end of July, they have had 37 cases reported in people under the age of 15. And this is really severe for the population because we cannot get the treatment in. It requires an intravenous immunoglobulin. And obviously, as you know, it's not just a blockade on food that Gaza has seen, it's also a blockade on medical supplies. And there is an urgency to get these drugs in, and there is just no way to do that while the blockade continues.
We spoke to one of the authors of The Lancet regarding this Guillain-Barré that caused, I believe, 1 death at least in Gaza. And he spoke also about the fact that so many Palestinians now have diseases that can't be treated at all by antibiotics. I don't know if they're even getting in at all, but as you say, it's just so dire.
The issue is that everything is not getting in. And the restrictions are being tightened and tightened. We've also just heard from COGAT that quite a few of the large charities have been deregulated, which means that they can't enter Gaza. This is particularly poignant for charities such as MAP, Medical Aid for Palestinians, also Rama, and many others are now unable to get their teams in. And these are big charities that would send teams of international doctors into Gaza every month. And those missions have now been cancelled for August and September. So even international doctors are being severely blocked from getting in. And we know that at least 50% of all surgeons that apply to enter are denied access by COGAT.
50%?
50%.
It's incredible. And you were recently there a few months ago. I'm sure the malnutrition levels already were terrible then. They're even worse now. The images that we show here all the time are just incredible. How much worse can it get?
We always say this whenever we go to Gaza. When we left in June, I remember talking to my colleagues about how much worse it could get. And then when we left, they cut the internet. So, I mean, there is no level that they can't go to. But it's just now the situation is more extreme than it's ever been. And we really need some action to get the humanitarian aid into these people before it's too late.
You know, we interview doctors in Gaza here nearly every week. And we have done for the past 22 months. And there's just one line that from one of the doctors at Nasser Hospital that he said, how many more children does the world have to keep seeing? And I'm sure that's a question for you, on your mind as well very often. How much more needs to play out on these screens? Because it is being live streamed, as what Abdul have said. People are watching us starve.
It's incredible, though, because there's still quite a proportion of the population and a lot in Israel that feel that all these images are AI generated. There was a spokesman, a major on Channel 4 earlier, accusing Channel 4 of displaying AI-generated images of starving children. And it really has got to a level where I'm not 100% certain that the people that need to understand that this is real and this is happening. And there are hundreds of doctors that can testify to this.
It's unbelievable that people can think that these children are AI-generated images. Dr. Victoria Rose, it's been a pleasure. Thank you very much indeed. And good luck to all the work that you're doing. Thank you.